Hello, my name is Dr. Alarina. I'm one of the senior residents in ophthalmology at McGill University. Today I'm going to be explaining some of the aspects of the ophthalmic examination so that we can boost your skills on how to do the routine eye exam. This video is geared towards medical students, junior residents, and other staff in emergency medicine and family medicine. So I hope you enjoy the video. Hopefully I'll be able to teach you some practical skills and make it fun at the same time. Okay, so today we're going to actually look at the slit lamp biomicroscope, which to me is probably the most useful tool that we have in ophthalmology to look at ocular pathology. Now this is the Hague 900. It's your most commonly used slit lamp that's readily available at most clinics. So basically I'm just going to show you some of the basics and how to make it work for you. Don't worry about it. I know it looks a little bit complicated with a lot of different dials and buttons, but I'm going to pretty much just simplify it and show you what you exactly need to know to get a good view of the eye and to examine all the ocular structures. So to begin, we're going to start with basically how to turn on the machine. So if we can draw your attention here, there's a little knob here, okay, that actually allows you to turn the power off, okay, and to turn the power on. What you want to do is you want to turn it all the way to get the power on, okay, which in this machine you turn clockwise and you'll see the indicator light showing the power is on. Sometimes there's actually a power switch on the arm of the slit lamp or on the base, so always make sure that that's on as well. Next, I'm going to bring your attention to the binoculars here, okay? This is also very important to set up before you examine the patient so that you can have a good view of the different structures of the eye. So usually it's set on 0 with no prescription dialed in. That's because most people use their glasses or contact lens correction when using the slit lamp. But what you can also do is you can actually take off your glasses and you can actually dial in your prescription if you don't want to use your glasses with the slit lamp. So on the binoculars here, you can actually see it actually goes to plus and minus. So you can turn the dial and move it from plus to minus depending on your prescription in either eye, okay? Also what you want to do is you want to also adjust your pupillary distance, which is very important. So what I do is I typically look through here and I focus on a structure. For example, if the patient's sitting, I can actually examine, take a look at their cornea. And what I do is I pull the binoculars apart or I push them together depending on your pupillary distance until the view becomes binocular and you have a good stereopsis and the picture in the image becomes very clear. Okay, so it's more of a feel, just pulling it apart and pushing it together. Okay, next we're gonna show you how to position a patient so you have the best ocular exam. Okay, I would like to now introduce one of our best medical students, Sumaya. She's going to be helping us with showing how to do proper patient positioning. Okay. So to begin, we have the patient seated. Make sure that they're comfortable in the chair. Okay, everything's great.
I'm comfortable.
You're doing well. Yeah. Good. Then what you want to do is you want to actually use the pedals on the ground to lift or lower the chair. There's pedals here. You can push on them to make the chair go up or make the chair go down. Just make sure that the patient's at a good position. There's also different buttons on the pedals where you can actually make the chair go back to when you're doing your fundus examination. Okay, so we'll put them. Alright, good. So now we're actually going to show how to raise and lower the arm of the slit lamp. So as you bring the slit lamp closer to the patient, there's actually a button on the side of the slit lamp, and if you push that button and hold it down, it releases the arm so you can raise or lower the arm. Okay? So what you want to do is you want to have everything set up so that the patient is able to put their forehead against the bar and their chin in the chin rest, okay? And so here I can see, just on initial examination, as I bring it in, she's slouching, her neck is flexed, so I want to make sure she's more comfortable. So what I can do is I can just adjust the arm. So I'm going to bring it up. I can see now, how are you? More comfortable now?
A bit too high.
A bit too high. So let's go down a bit, no problem.
That's perfect.
Don't worry about it. So I'll take care of her. And so now this is much better. And are you comfortable now?
Yeah.
Perfect. So now she's nice and comfortable and you're ready to start your exam. Okay, now that we have the patient in position, we want to do some, fine tuning to make sure that you're ready for the exam. So next what I want to do is I actually want to make sure the patient's at a good height in terms of her chin and the marker. So here's the lateral canthus marker. You want to make sure the black marker is actually in line with the lateral canthus, which in this terms it looks pretty good. What I can do is I can actually bring the whole machine up or down, the whole chin rest up and down by turning the knob here. So as I turn the knob counterclockwise, it goes down. As I turn it clockwise, it moves the whole machine up. And now I have her nicely lined up with the marker. Okay? Forehead is nicely touching, her chin is there. Are you comfortable? Is it a good height for you? Perfect. If you notice that the patient is then stretching their neck when you lift up the chin rest, you can also bring the table up and down as I showed you before. Okay, so looks like we're ready to get started now for the eye exam. So what I want to do next is actually I want to unlock the machine. The machine, as you know now, is locked for safety reasons. You don't want the machine to fly forward and hit the patient. So what I do is I turn the knob here counterclockwise. Okay, so as we turn it counterclockwise now, the machine is free. Okay, now the machine moves in different axes. It moves forward, backwards, left and right, so X, Y axis. Okay, and you can also rotate it a little bit as well, like this in the Z axis. Okay, so you have that nice freedom of movement. Okay. What I also like to have the patient do before I start is I have them hold the armrest here. That way they can hold themselves up in the machine. This is very useful, especially for your elderly patients who have trouble, neck stiffness or cervical, issues and difficulty, staying up in the machine. This way they can help, stay in a good position. So next, what we want to do is we actually want to examine the eye. Great. Now I want to show you the essential features of the slit lamp biomicroscope. So I want you to pay attention to just the elements that I'm going to show you. Anything more you don't need to know about, don't need to use. For your routine eye exam, these are the only features that are going to help you to get a good exam. Okay, so we start with this knob here. This joystick actually raises and lowers the entire base of the slit lamp. Okay, so if you see me, I'm turning it clockwise. The machine goes up. As I turn it counterclockwise, the whole machine goes down. Okay, so that's very important when you want to raise or lower the beam when you're looking at the cornea, for example, here. The next knob I want you to look at is the other knob that you're going to hold in your hand on the left side. What I tend to do is I use my dominant hand to hold the joystick, and my left hand rotates the light like this and also holds the knob on the bottom. This is the most natural position, and this is the only position you need to have during your exam. Okay, so as you can focus here, you can see that when I turn the knob, okay, clockwise, what it does is it makes the beam wider, and you can see as we look at our eye here, the beam is getting wider as I move this clockwise. As I rotate the opposite direction, counterclockwise, the beam gets more narrow. Okay, so very important, because a narrow beam is very good, as I'll show you later in the video, to examine the cornea and different sections of the cornea. Okay, so that's very important. So next what we want to do is we want to get this nice and centered. Okay, always remember this here is basically our tonometer tip, our Goldman tonometer, applanation tonometry to measure the intraocular pressure. This device is good to use in more, for the advanced, physician. At the beginning, it's not the easiest to use, so I would just move it back, lock it here. Don't use it for now. What you can use to measure the pressure in the eye is the tono pen, which we'll be showing in our subsequent videos, so soon to come. Next knob that you want to be familiar with is this one here. Okay, so we know how to make the beam wider and more narrow. Now, how do we change the height of the beam? Well, we use this one here. So what I do is I turn it clockwise, okay? And what it does is it actually will make the beam go either lower, shorter, or higher, okay? If you keep rotating the knob, it'll actually click, and what you can see is that it'll actually turn the light blue. So if you focus on our eye now, you can see now I'm on the blue filter, okay? If I turn it the other way, watch the beam become shorter and higher, okay? So very important to keep that in mind, okay? When you're doing your exam. Next thing I'm going to show you here, okay, is there's 3 or 4 different filters here, okay? And what these do is they allow you to change the light intensity, okay? So you can actually change it when it's all the way to the end. On this machine in particular, it's at the brightest light intensity. If you move it towards the middle, it actually goes to a lower light intensity, which we use for our fundoscopic exam. And if you move it all the way to the side, you can actually get different filters. So this one here has a green filter, which is our red-free filter. We tend to use a green filter, the red-free, when we're examining blood in the eye. When you put this filter on, the green filter, blood will actually show up black. So if you're looking for example, a microhyphema in the anterior chamber, you can use this filter to help you pick out the red blood cells. And again, if you want the blue filter, you can just put it on the normal light and then just turn it all the way until it clicks, and then you have the blue filter, okay? So now, what I want to show you basically, I want to review 3 most essential elements of the eye exam that we talked about. So again, positioning, your right hand on the joystick, left hand on the light source, okay? That's one. Two is basically, again, rotating the light source with your hand here, and also widening the beam, either wide or narrow. And three is the height of the beam, which is just done up here, okay, to make it short or to make it high. So again, those are your three most essential elements of the exam: how to wind the beam, how to position yourself, and how to make it higher or shorter. So one of the most challenging parts of the Slit Lamp exam, I find for medical students, is how to play around with the magnification of the exam. And sometimes when they go to examine for the first time, it's on high magnification and they have trouble finding the structures of the eye. So I want you to pay attention here and how to change the magnification. It's always best to keep it at 1x zoom when you're first doing your exam instead of the 1.6 or the 2x zoom. Sometimes there's a magnification bar on the newer machines on the side. It's a dial that you can rotate. So always make sure it's on 1 when you start your exam. And later I'll show you why you need to increase magnification to look at certain parts of the eye. Okay. So now I want you to follow me as I look and get her eye into focus. Okay. So again, make sure that you're also in good position because you're ready to start your exam. I'm a bit high. As you can see, I'm going to be leaning forward. So I'm going to bring my chair down so that I'm nicely centered with the binoculars. And now what I'm going to do is I'm going to look through. It's going to be blurry when you first look through, okay? I've adjusted again for my my pupillary distance and my prescription. And what you do is you want to, again, get in position, like I told you, the two hands, and move in very slowly, okay? And you're going to see that it'll be blurry, 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 and then you'll see it'll come into focus. Right now I'm focused actually on her eyelashes, and I can see them in great detail. It's amazing the view that you can see with this slit lamp. This is a real biral microscope. It's a real microscope looking at the intricate ocular structures in real time. So you're looking at real pathology in real time, which is really cool. So now basically I have it positioned on her eye and I have a nice view of all the structures. So next we're going to move on to how to examine the eye from the outside in. Okay, now I'm going to describe my approach to examining the eye. Okay, I like to use a systematic approach from outside in, starting with the structures around the eye. So as you can see here, you can look at the skin just below the lower and upper eyelids, okay? And you want to look for, are there any lesions, for example, any benign or malignant lesions that could be basal cell or squamous cell carcinoma, which tend to be on the lower eyelid. So look for those, do a general inspection, okay? And then you can slowly move upwards and take a look at the lid margin. I can zoom in here, increase the magnification to basically look at the lid margin, okay? So now we get into focus here. And we can look at the different structures of the lid, okay? So what I like to do, I like to use a Q-tip. It tends to work well, okay? And I have the patient look straight ahead. So with your other eye, please look at my ear, okay? That way you know that they're looking straight ahead, right at my ear. And gently pull the lower eyelid down. So now I can actually look at the structures here, okay? Get that in focus again. And so we want to start from outside in. So look at the lid margin, see if there's any erythema, any edema of the lid margin, okay? Sometimes if you have a diffuse erythema or edema, that can be a sign of preseptal cellulitis. Also, if there's a localized area of edema, that could be also a chalazion. So look for that. Look at the punctum, make sure it's open. Move across, okay, look at the lid margin. If there's any notching or change in contour of the lid margin, you should be wary of that. Any little notches could be signs of blepharitis, so look for that as well. And then you want to move out and look at the lashes, okay? Very important to look at the lashes. Look at, the lash follicle itself. Are there any collarettes, any signs of scurf, which basically is that white debris on the lashes. That can be, again, signs of blepharitis, okay? And look closely. Now you're going to see the meibomian glands, which are these tiny little glands that open up, to the tarsal plate. And these glands secrete the oils that make up our tears. So look to make sure that there's no blockage of the meibomian glands. Move across the eyelid nice and slow. And you want to just gently put some pressure on the lower eyelid and just see if there's any oil coming out of it. Make sure there's no sebum, that it's not yellow or turbid like toothpaste. That can be another sign of blepharitis. So look closely at that, okay? And then continue your exam. Now have the patient look up. When they look up, now you have a better view of the palpebral conjunctiva and inferior fornix. So again, I can look at all the structures here. I can actually see, you can see that those stripes there, underlying tarsus. You can see the vessels overlying it. You can move across. Very important to look here, especially in a patient with viral conjunctivitis, because you can actually see little follicles and papilla. And especially if you put fluorescein dye, those follicles or papillae can light up and you can get a good appreciation of those. So important to look at that during your exam, okay? And look for any lesions here as well as you make your way to the sclera. Okay, now let's jump to the upper eyelid. So now we're looking at the upper eyelid. Same thing, look at the lid margins, look at the lashes and the upper eyelid, okay? Unique thing about the upper eyelid is you can look also at the lacrimal gland. So have the patient look down and just gently pull up on the eyelid here, okay? And you can see if there's any prolapse of the lacrimal gland just here in the temporal area, which there isn't, okay? Looks healthy and normal here. Now look straight ahead. Good. And now what you can also do is you can also lift the eyelid and look across. Again, look at the same structures. What I like to do too, if I'm worried about a cornea, foreign body, any trauma to the eye, I like to invert the upper eyelid and look for any foreign body there, any follicles again, any papilla, so we can do that as well. So basically move across the eyelid, take a look at all the structures. Next, what I want to do, again, I want to be systematic. So I want to move from out to in. So I've done my lids, my lashes, my lacrimal system. Next, I'm going to move on to the sclera and the conjunctiva, okay? So I'm looking at the conjunctiva. What I like to do is I like to have the patient actually move their eye as I focus on different areas of the conjunctiva. So look to the left, please. Okay, but look to the left now. I'm looking at the temporal side. Look at the vessels, the episcleral vessels and sclera. Look to the right. Again, you're focusing here on the conjunctiva and sclera, and you can see some structures over here like the carbuncle, for example. Okay, very important again to look for lesions there. Look up, please. As they look up, you can use the Q-tip again or your finger just to pull lightly down. And again, look at the bulbar conjunctiva, look at the vessels. Sometimes you can see some peculiar vessels. For example, if someone has a CC fistula, they can actually get these vessels called corkscrew vessels that are corkscrew in shape. You can also get coma-shaped vessels and diseases like sickle cell disease. So it's very important to look at all the structures. Look down, please. And again, I'm going to pull the eyelids just gently upwards. And we're going to look to see how the conjunctiva looks, okay? Everything looks very healthy here. Now look straight ahead. Beautiful. Okay. Okay, next we're going to basically look at the cornea. Okay, starting with the limbus. Look straight ahead at my ear, please. Good. So just focus on the limbus here. You can increase the magnification as you move on to this step. Okay, just because you want to look at the structures in more detail. Swing the light over, okay, and look at the cornea. I like to make a nice thin section when I look at the cornea, okay? Very important. This is called the optical section or parallelopiped. And now you can see the beam is split into two. You can increase your light a little bit here and you'll get a better view. The first beam, they call it parallelopiped because geometrically it looks like that shape. And it actually shows you a nice cross-section of the cornea. You can look at active histology with the microscope here. So you can look at the corneal epithelium, the corneal stroma, and the corneal endothelium with the first white beam, okay? So swing that across the eye, look at all the layers. Sometimes in different diseases, like for example, in Fuchs dystrophy, you can see things what it's called or described as the beaten bronze appearance of the corneal endothelium. So it looks like little beads on the endothelium and the first light beam. So look for that, okay? And you can look for guttata as well, which are little beadings on the endothelium. So very important, okay, to look for all these structures. I'm also going to teach you now the von Herrick method. Von Herrick method is a way to look at the depth of the anterior chamber. So as I swing the light over, what I want to do is I want to compare basically the distance between the first beam and the second beam, okay? So that's the von Herrick method. If I can fit the first beam within the two beams, that means it's one corneal thickness deep, okay? Because the first beam is the corneal thickness. So here, for example, this I would say is maybe about 2, maybe 3 corneal thickness deep in the periphery of the cornea, which means that the angle is open. If you're worried about a narrow angle, a lot of times you'll have less than 1 corneal thickness between the two beams. So look for that, and that's a sign of a narrow or closed angle. Then you need to move on to gonioscopy exam. With the gonioscopy, you can actually look at the angles to look at the structures to see if it's open or closed, okay? So then move across again. Look centrally at how deep it is. You can see it's nice and deep in the center here. And again, the periphery over here is also nice and deep. And we're going to move to the center here. And next, we're going to look at basically the anterior chamber. Okay, now, very importantly, we're going to look at the anterior chamber and look for cells and flare, okay, in the anterior chamber. So what I like to do here, again, I keep my beam nice and thin. You want to increase your magnification because we're going to look right through the pupil here, okay? Look at that beautiful view. And then I'm going to actually, remember the knob I showed you to make the beam height lower. So now I've decreased my beam height, okay? What I'm going to do, I'm going to decrease the light intensity in the background. Look at that. Unbelievable. and I'm going to increase the light intensity, okay? So there we go. We have a beautiful section, okay, through the pupil. The reason why we shine it over the pupil is because we want a nice contrast. We want a black background to look for cells. So here, there's the pupil margin. I'm right in the center of the pupil here. I'm looking between the first beam, the bright beam, and the second beam to see if there's any cells, white cells or red blood cells floating around. Here it's quiet. That's why we see the anterior chamber is deep based on von Herrick method, and quiet because there's no cells here. Okay, very important. So that's a nice view there, all right? Now we can make the beam a bit higher. You can keep it on high meg if you'd like, or if it's too high you can decrease it. But you can look at the pupillary margin now, which is good. I'm just going to lower the light intensity here. There we go. And I'm just going to widen my beam, and look at that. Look at that beautiful, beautiful structure there. Look at that pupillary margin, okay? Now here we don't see, you're looking for any rough, pupillary rough, any defects of the iris. We call them transillumination defects when you shine light through. Is there any defects of the iris? You can look for white material, which you see often in pseudo-exfoliation syndrome. Here it looks nice and clear. You see a nice rough around the pupillary margin. Move your beam across, take a good look. And then finally you want to look in the middle of the lens here, okay? So make a thin section. And look, you can see that white center right there. That's the lens, okay? And if you just focus on the lens and move it a little bit more posteriorly, push your joystick forward, you can actually look into the vitreous and see if we can see anything here. Look up, please. Look down and look straight ahead. Let's try it from this angle. Again, up, down, straight ahead. And I have her do that so I can move the vitreous, okay? It's pretty, optically there's not much you can see here. You can see a little bit. Look up again, down, and straight ahead. All right, so that concludes our video. Thank you for watching. I hope you enjoyed it. By watching these videos, you're going to master the basics of the slit lamp exam. Stay tuned. Make sure to watch our next videos, and thank you.
Saving eyes and saving lives.